Your health, brought to you by Covered California.
It's the season for giving, but you may want to double check some of the items on your child's wish list. A new report says toy-related injuries are sending a record number of children to the ER. So what should parents be looking out for? Dr. Mitchel Goldman with UCSD, as he is every Tuesday, is here now to talk about some of these disturbing statistics. Thanks for being here.
It's always good to be here.
Well, the first statistic that I found startling and caught my attention is that a child is treated in an ER for toy-related injuries every 3 minutes.
It's really true, and it's two basic things that are being treated in the ER. One is swallowing something. And you know, little kids can swallow so many things. My daughter Risa, when she was 1 year old, all of a sudden I was looking and she turned blue and she had swallowed a little button off of her toy bear. And it just instinctively, you do the Heimlich maneuver, it comes out. But it happened to me, so it can happen to anyone. And so swallowing objects is important. Now, it's not just like little things or buttons that come off of toys or Legos. It's also things like magnets. You know, if a kid swallows magnets, it can actually perforate the intestines. If they swallow batteries, it can also literally do a chemical reaction. So kids swallowing things is a major problem. And that's why if you buy toys that have little teeny parts, you have to really make sure that the little kids don't eat them.
You know, and those detachable parts really aren't the only problem. You brought up how the toys are made is an issue, and lead paint is a serious one, is it not?
It really is. You know, back in the 70s, the U.S. government, we stopped putting lead in paint. But foreign countries still do. And so lead is available in foreign toys. It's also available in some antique or toys that are passed down. And there's lots of problems with lead. When little kids will ingest lead, it can actually impair their mental and physical development. And so it's very important to make sure the products don't contain lead.
Now, is there a way for parents who think that their child might have had lead exposure can tell? Are there symptoms that are obvious?
Well, they're not that obvious. You know, when lead poisoning is severe, there's nausea, of course, that occurs. Some lead poisoning, you get a tingling in the fingers, or the kids just aren't acting the proper way. But really, a blood test is the only way we're going to figure it out.
All right, well, let's talk about some of the ways that parents can recognize problematic toys. We have some safety tips.
Well, there's a number of different ways. First of all, if your kids have a push toy, you know, that's the number one problem there is falling down, breaking your arm. And so that's another bad thing. So if you have kids on scooters, make sure they have helmets on. Now, there's a number of different websites we can go to make sure that the toys are safe. But, you know, other things we should look out to, again, batteries that can be easily removed, magnets that can be easily removed and swallowed, and then the most important thing that I want to impress on everyone, because it happened to me, small parts, buttons, Legos, things like that.
All right, some very timely advice. Our Dr. G on Tuesday. We'll see you back here a week from today. Thank you.
Always good to be